You see, gut microbiota are the group of organisms that are present in the gut, that is mainly in the large gut. They are very beneficial for the health of the human being, and they produce certain substances which have immunomodulatory action, which also are helpful for chronic diseases like diabetes, cardiovascular disease, autoimmune disease, and various other chronic diseases like chronic kidney disease. And these microbiota, they are very helpful to us, and they have also immunomodulatory action that is very important. And in this COVID era, it is also very important, and the immunomodulation is very, very important. So for the last 2 years, we are passing through the COVID era. We have seen the various phases of COVID infection, first phase, second phase, third phase, and India has also faced the fourth phase. And we have seen that the increased incidence of cardiovascular disease and cardiovascular mortality, the patients of diabetes, they have suffered a lot from COVID infection than the normal population. And why this is happening? So if you see that it is multifactorial. Besides several factors in the host, the gut microbiome is having an important role, particularly in the context of cardiovascular disease. The gut microbiome, they produce substances like short chain fatty acids, like butyrates, and certain other substances which are beneficial for the human being and the protection of the heart, like control of blood pressure, control of lipid profile. And because there is dysbiosis during COVID era, there is disturbance of this microbiota, and the production of certain essential substances are lacking, as a result of which increased incidence of hypertension, cardiovascular mortality is there. Then if you come to diabetes, these substances produced by this normal microbiome, that is also deficient when there is gut dysbiosis due to COVID, as a result of which increased incidence of diabetes, there is increase in incidence of new onset diabetes, there is also increased diabetic mortality. So these things are happening. And there is increased surge about the last part of your question, that is increased surge of GI complications in the COVID era. Definitely, you know that when there is a COVID infection, mainly the site is the lungs, the alveoli of the lungs that is damaged, and the microbiota which are also present in the lungs, they are damaged, and the virus is carried also through the long gut axis. There is a long gut axis, physiological axis, through which the virus moves to the intestine. They affect the enterocytes, which are the epithelial cells of the intestine, and they disturb the gut microbiota, and there is disturbance of the normal microbiota of the gut, as a result of which there is increased surge of various GI complications in the form of gastrointestinal reflux disease, dyspepsia, diarrhea, irritable bowel, and so many other GI complications we are coming across. Even after the patient have been cured from the COVID, they are also suffering from a lot of GI problems because of the disturbed gut flora. There are so many chronic conditions we come across. Like, as you have already told, you are giving importance to 2 diseases like diabetes and hypertension. Besides that, we are having chronic kidney disease, we are having immunological diseases, we are having also some inflammatory bowel disease like irritable bowel syndrome, and also the ulcerative colitis, Crohn's disease. There are so many other diseases like atopic eczema, patients having then atopic asthma, rheumatoid arthritis. All these diseases, they require the help of gut microbiota. The gut microbiota produce, I have already told, certain substances which are very helpful for these diseases. So in my clinical practice, I have used In inflammatory bowel disease, I have used probiotics. In patients who are on chronic antibiotic therapy, the gut microbiota is suppressed and there is overgrowth of pathogenic organisms. To suppress them also, we have to give probiotics as supplements so that they will normalize the gut flora, and as a result of which the immunological modulation in the gut will improve and patients will be cured from the disease. So we have used it in diabetes, cardiovascular disease, autoimmune disorders, in case of respiratory disorders, inflammatory bowel disease, in so many conditions we have used probiotics, but they are extremely helpful in these conditions. Very good question. The thing is that actually we know gut flora since long. We know that they are very beneficial, they produce B complex and that is helpful for us. But in the recent years, what we see, our conception has changed. They are not only the vitamin producing commensals in the intestine, they are having a lot of role in human body physiology. As I have already told, they stimulate the immune booster, as a result of which they suppress various reactions like suppress the cytokine storms, which is very dangerous in the COVID era. They also modulate immunity so that the T cell stimulation, the B cell stimulation, the various dendritic stimulation, all these immunological cells are stimulated and become active and fight against the disease. They also change the metabolic diseases like diabetes and the cardiac diseases also. In particular in diabetes, they increase the insulin sensitivity, they inhibit these gut microbiota produce substances which inhibit the insulin resistance, as a result of which diabetes very well controlled. They suppress the atherosclerotic process, they decrease the level of lipid profiles, they suppress or inhibit the process of atherogenesis, as a result of which they are very beneficial for cardiovascular disease. So our conception about the use of probiotics has been changed. It has been changed for only the commensals of the gut flora, helpful to our application to various disease states where they can be applied and we can get benefit for the human health. Particularly chronic diseases, I have already enumerated, they are treated with their primary condition, diabetes with insulin, cardiovascular disease with the anti-hypertensive drugs, lipid reducing drugs, so many drugs, that is the primary treatment. But you will see that the improvement is not very good as we expect. So if we add a probiotic and you will see that their gut flora is normalized, you will see that their blood pressure will be controlled. With the same drugs, what we are using, they are not controlled. Diabetes with insulin or with oral anti-diabetic drugs, they are not controlled. If we see that we add probiotics, they will be easily controlled. So the borderline cases, we are having a very good response with the use of probiotics. Well, very nice question. The thing is that exactly I cannot give a single example, but I have used probiotics in a huge number of patients. So from my experience, I can tell that particularly in inflammatory bowel disease, I use probiotics for a period of almost 3 to 4 months, even 6 months I use. In case of chronic liver disease, where the patient is having impending encephalopathy, probiotics are used because the gut flora is very important for chronic liver disease, because there is production of ammonia by the pathogenic organisms, and if you give probiotics, they will suppress the pathogenic organisms which produce ammonia, and there is development of normal gut flora, so that the ammonia mechanism is suppressed and they are much more benefited. To the patients of chronic liver disease, I have used myself for about 6 months with probiotics. They have improved. patients with antibiotic associated diarrhea, when we will give probiotics, we see that they improve within 7 days. There we can use it for 1 month. And some other acute viral diseases, we can use for 1 month. So in so many conditions, for diseases like diabetes, we have to use it for a prolonged period. For cardiovascular disease, we can use it for a prolonged period. For a short duration illness, like infectious disease, respiratory infections, or any GI infections, we can use for a short period of time, like 1 month. So if we come to the oral anti-diabetic agents, the drugs I will enumerate having GI side effects are the metformin, which is the age-old drug, the cornerstone of diabetic treatment. Almost 90% of the patients use, particularly type 2 diabetic patients. It is having a lot of side effects like belching, diarrhea, abdominal fullness, dyspepsia, all these things. Metformin, you know it, I think. Then if we'll come to the gliptins, the drugs, I cannot tell most recent drugs, but they have come almost 1 decade. Gliptins, the incretin group of drugs, they also have GI side effects like flatulence, diarrhea. Sometimes in the early phase, they may be adjusted later. Coming to GLP analogs, they are very costly drugs. In India, their usage is less. Still, then they are having a lot of side effects like vomiting, flatulence, anorexia, all these things. If we tell about sulfonylurea, like glipizide, that also is having constipation, diarrhea, flatulence, all these things are there. So in most of these drugs, other drugs I do not know about pioglitazone. These drugs I do not know they are having, but these 3 to 4 drugs I know, the oral anti-diabetic drugs having GI side effects. If you will concomitantly use probiotics in these patients, the side effects will be lessened. And you can use the drugs. In the initial phase, they will have side effects. And once you use these drugs with probiotics, the side effect will be lessened and the patient will take the drug regularly. And later on, you can discontinue the drug and you will see that the patient will tolerate easily and he will be benefited. The glycemic control will be better.